September is National Recovery Month. Recovery from addiction is possible, but for some, just reaching out for help is a challenge in itself. Dr. Jon Siebert, Medical Director for Valley Hope, joins us with some insight on what happens at Valley Hope. And first question of all, what are you seeing in our area when it comes to the opioid pandemic?
Yeah, things have changed. It's a matter of, I was talking earlier, we've kind of watched heroin creep across Missouri into the Kansas City and Atchison area, and that was probably 4 or 5 years ago. Now it's almost rare to hear of anyone taking anything but fentanyl.
Wow.
Far more potent, far more lethal drug. Kind of a perfect storm of it's much cheaper but much more lethal, so the overdoses have certainly picked up.
Wow, that's definitely interesting to note. How does addiction stigma really impact people that need help?
Estimates are out there that of the people who do know they need help, only about 1 out of 10 actually reach out. So it certainly is a problem. It's a disease that needs to be diagnosed in order to be treated, and if people aren't reaching out for help, it's never going to be diagnosed.
Absolutely. And can you give us a little insight on the treatment in particular at Valley Hope for those who seek help and reach out?
Sure. So we have residential treatment center at Atchison Valley Hope where I work, and then also outpatient treatment in Overland Park. We're not a fly-by-night operation. Valley Hope's been around for over 50 years now. We've treated over 300,000 people, not just at that facility, but nationwide. Sure. It's a really special place to be. I mean, when people check in, it's a very welcoming environment. But we're also fairly cutting edge with our therapies too. I mean, we do stay on top, not just with the scientific piece, the medical piece that I do, but with the counseling pieces too. We try to use evidence-based practices in all that we do.
Yeah, absolutely. So could you elaborate a little more on what those sound like or what that looks like? I mean, since it is so unique to you guys in particular.
It sounds corny, but there's just a level of love to everything we do. And that goes everywhere from, the maintenance staff and the kitchen staff on up to counseling, nurses, me, everybody else. It's a really fun place to work. But as far as the treatments available, the counselors stay on top of all the latest and greatest things to do as far as helping people through recovery. We certainly use medications to aid people in recovery, particularly from alcohol and opioid use disorder problems. Outside
of just medication, what are the other types of things that you guys can offer if somebody may not want to go that route?
Sure. So kind of the term is biopsychosocial, and then we add the term spiritual. So the biological part, me. Psychological with counseling, social, it's a family disease, so we want to make sure that we're getting into all your social interactions with family members and loved ones. And spiritual is a part of it for us too. Everyone does get assigned a chaplain when they're at Valley Hope, and so if people need to focus on their spirituality, that's certainly a part of things at Valley Hope as well.
And how does Valley Hope support patients in recovery once they leave after treatment?
A lot of people have the misconception that you go to rehab and you leave and you're fixed.
Sure.
It's a day-to-day ongoing process, just like treating any other chronic disease. But our alumni are strong, and actually a lot of our new patients come as referrals from alumni. But the alumni continue to get together. Renewal Day, a group will come back and get together. Hopefully after the pandemic's over, we can do more and more of that. But those are really special events where people get together and share their stories and stories of success and stories of hope for other people struggling.
Valley Hope offers both residential and outpatient programs for drug and alcohol addiction treatment. They have several locations across the U.S., and in our area, there's one in Overland Park and one in Atchison. So to learn more, go online to valleyhope.org or call 800-544-5101 to speak confidentially with a treatment and recovery expert.